My next guest says that trauma is stored in our bodies and we have the ability to release it. How? It involves a series of exercises, muscle contractions, tension patterns, and a whole lot of shaking. Take a look. Mary, what is TRE?
TRE stands for Tension, Stress, and Trauma Release, and it's a method of relaxation.
Well, now who developed this method?
Dr. David Berceli. David Berceli was actually in the Middle East, working in war-torn countries, when he noticed or observed people in bomb shelters all reacting in the same way. When they were in safety, their bodies would all start to shake, and he asked himself, this must mean something, this must be helpful. Essentially what we're trying to do is to fatigue a certain group of muscles that happen to be all involved in this stress response. So we're using the same muscles that the body calls on to protect itself.
Mary, earlier you put some of my staff through the protocol and a short TRE session.
So fatigue your calf. Don't worry about what the other person's doing.
Mary showed Megan and Ben a series of protocol exercises. These exercises are designed to mildly stress the muscles.
Swivel with the hips. Lead with your hips to one side. Let your shoulders follow. Now the head goes to the back.
When these were completed, Mary put Megan and Ben in position to begin the method.
Now come on up, bring your pelvises up. We're going to hold for 1 minute. You may sway, you may bounce. And we're using the physical tremor, which comes from holding a muscle in a position for a long time. That physical fatigue is going to become a therapeutic tremor. The difference between the therapeutic tremoring and all the other kind of tremors that exist is that this is going to change in frequency, amplitude, and intensity, and it will migrate through your body at rest. That's what makes it different. So 2 more inches, guys. And let's put our feet flat on the floor and let the tremoring just continue in that position. And as we sit here a little longer, it deepens, and as you do your practice over time, it deepens.
What are the advantages to TRE compared to traditional therapy?
It's very different. A lot of therapies that are all really useful will help to relieve stress in the moment, but actually TRE goes deeper, and when it's done properly as a deepened practice, it'll go get deep-seated stress from the past, stuff that's been stored in the body over a long period of time, and it helps to release it from the body altogether.
Are there any studies that prove its effectiveness?
We've got studies underway right now. We have had the Department of Defense Centers for Excellence do a study where we are considered a level 3 methodology, where the soldiers that were deployed would use this with yoga and meditation, and it was considered to be a very favorable method for releasing trauma from the body, but much research is needed.
What kind of trauma can TRE help with?
Anywhere from old, what we call developmental trauma from childhood, to acute trauma, chronic stress, and even sometimes PTSD. But again, it needs to be done in a deepened practice properly.
How many sessions do you suggest people should go through?
In order to really get all of the benefits from TRE, just like brushing your teeth, you don't just do it once and say, okay, all the bacteria is gone. You need to do it over and over again. So we recommend that you do it 3 times a week at the very beginning for at least 15 minutes. And then once you understand all the principles of how to keep yourself safe and to know when is enough, then it becomes a self-care program that you can do for the rest of your life. It's a tool you have forever. Most unusual, but maybe worth a try.
If you'd like to learn more, go to traumaprevention.com.